Some people see the world like this. Some people see the snowfall like this. Some people see everything very nicely like this. General information about mixed salts of a single entity amphetamine product. Medicines are sometimes prescribed for purposes other than those listed in medication guides. Do not use mixed salts of a single entity amphetamine product for a condition for which they were not prescribed. Do not give mixed salts of a single entity amphetamine product to other people, even if they have the same condition. It may harm them, and it is against the law. This medication guide summarizes the most important information about mixed salts of a single entity amphetamine product, also known as Adderall. If you would like more information, talk with your doctor. You can ask your doctor or pharmacist for information about mixed salts of a single entity amphetamine product that was written for healthcare professionals, or you can visit www.mallinckrodt.com or call 1-800-778-7898. What are the ingredients in mixed salts of a single entity amphetamine product? Active ingredients: dextroamphetamine saccharate, amphetamine aspartate monohydrate, dextroamphetamine sulfate USP, and amphetamine sulfate USP. Active ingredients. Inactive ingredients now: microcrystalline cellulose, silicone dioxide, providone, and stearic acid. This medication guide has been approved by the United States Food and Drug Administration. Mallinckrodt, the M brand mark, and the Mallinckrodt Pharmaceuticals logo are trademarks of Mallinckrodt Company. Copyright Mallinckrodt. That's Spec GX LLC, Webster Groves, Missouri, 6311 USA. This has been another public service announcement by Vizdos TV, brought to you from the makers of single entity mixed salts amphetamine products, more commonly known as Adderall. This is the generic brand. This is not a test. This is reality, and this is what the doctors are giving to your children, to you, and to your grandparents. Remember, this can kill you. If a doctor gives it to you, it's okay. If your neighbor gives it to you, you're going to jail. Either way, it's really, 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 really. Other people see the world like this. They see the world through bars. They see cages. They don't get to see much. The world does not have much to offer them. But guess what? The world for everyone can be like this. Adderall, medication guide for the generic dextroamphetamine saccharate, amphetamine aspartate, dextroamphetamine sulfate, amphetamine sulfate tablets, mixed salts of a single entity amphetamine product, RX only, C2. Read the medication guide that comes with mixed salts of a single entity amphetamine product before you or your child starts taking it, and each time you get a refill. There may be new information. This medication guide does not take the place of talking to your doctor about your or your child's treatment with mixed salts of a single entity amphetamine product. What is the most important information I should know about mixed salts of a single amphetamine product? The following have been reported with use of mixed salts of a single entity amphetamine product and other stimulant medicine. 1. Heart-related problems. Sudden death in patients who have heart problems or heart defects. Stroke and heart attack in adults. Increased blood pressure and heart rate. Tell your doctor if you or your child have any heart problems, heart defects, high blood pressure, or a family history of these problems. Your doctor should check you or your child carefully for heart problems before starting mixed salts of a single amphetamine entity product. Your doctor should check your or your child's blood pressure and heart rate regularly during treatment with mixed salts of a single entity amphetamine product. Call your doctor right away if you or your child have any signs of heart problems such as chest pain, shortness of breath, or fainting while taking mixed salts of a single entity amphetamine product. Number 2, mental psychiatric problems. All patients. New or worse behavior and thought problems. New or worse bipolar illness. New or worse aggressive behavior or hostility. Children and teenagers. New psychotic symptoms such as hearing voices, believing things that are not true or are suspicious, or new manic symptoms. Tell your doctor about any mental problems you or your child have, about a family history of suicide, bipolar illness, or depression. Call your doctor right away if you or your child have any new or worsening mental symptoms or problems while taking mixed salts of a single entity amphetamine product, especially seeing or hearing things that are not real, believing things that are not real, or are suspicious. Number 3, circulation problems. In fingers and toes, peripheral vasculopathy, including Raynaud's phenomenon. Fingers or toes may feel numb, cool, painful, or may change color from pale to blue to red. Tell your doctor if you have or your child has numbness, pain, skin color change, or sensitivity to temperatures in the fingers or toes. Call your doctor right away if you have or your child has any signs of unexplained wounds appearing on fingers or toes while taking mixed salts of a single entity amphetamine product. And just a reminder, all you caring people and medical professionals, mixed salts of a single entity amphetamine product is the same as Adderall. What are mixed salts of a single amphetamine product? Mixed salts of a single amphetamine entity product are a central nervous system stimulant prescription medicine. They are used for the treatment of attention hyperactivity disorder, ADHD. Mixed salts of a single entity amphetamine product may help increase attention and decrease impulsiveness and hyperactivity in patients with ADHD. Mixed salts of a single entity amphetamine product should be used as part of a total treatment program for ADHD that may include counseling or other therapies. Mixed salts of a single entity amphetamine product, or Adderall, are also used in the treatment of a sleep disorder called narcolepsy. Mixed salts of a single entity amphetamine product are federally controlled substances, C2, because they can be abused or lead to dependence. Keep mixed salts of a single entity amphetamine product in a safe place to prevent misuse and abuse. Selling or giving away mixed salts of a single amphetamine product may harm others and is against the law. That's kind of funny because that's exactly what doctors do. And pharmacists do that also. And the government approves them to do that. Let me repeat what it says here in the directions. Selling or giving away mixed salts of a single entity amphetamine product may harm others and is against the law. Great job, American Medical Association. Tell your doctor if you or your child or family or have a family history of ever abused, been dependent on alcohol, prescription medicines, or street drugs. Who should not take mixed salts of a single entity amphetamine product? Mixed salts of a single entity amphetamine product should not be taken if you or your child have heart disease or hardening of the arteries, have moderate to severe high blood pressure, have hyperthyroidism, have an eye problem called glaucoma, are very anxious, tense, or agitated, have a history of drug abuse, are taken or have taken within the past 14 days an antidepressant medicine called monoamine oxidase inhibitor, or MAOI. Or if you are sensitive to, allergic to, or had a reaction to other stimulant medicines. Mixed salts of a single entity amphetamine product, which is the generic for Adderall, which is commonly prescribed. It is commonly sold, and it's, I guess, against the law for people to use it if they're not given it by a doctor. Anyways, let's move on. Mixed salts of a single entity amphetamine product are not recommended for children less than 3 years old. Mixed salts of a single entity amphetamine product may not be right for you or your child. Before starting mixed salts of a single entity amphetamine product, tell your or your child's doctor about all health conditions or family history of, including heart problems, heart defects, high blood pressure, mental problems including psychosis, mania, bipolar illness or depression, tics or Tourette syndrome, liver or kidney problems, thyroid problems, seizures, or have had an abnormal brainwave test, EEG, or circulation problems in fingers and toes. Tell your doctor if you or your child are pregnant, planning to become pregnant, or breastfeeding. Can mixed salts of a single entity amphetamine product be taken with other medicines? Tell your doctor about all of the medicines that you or your child take, including prescription and non-prescription medicines, vitamins, and herbal supplements. Mixed salts of a single entity amphetamine product and some medicines may interact with each other and cause serious side effects. Sometimes the doses of other medicines will need to be adjusted while taking mixed salts of a single entity amphetamine product. Your doctor will decide whether mixed salts of a single entity amphetamine product can be taken with other medicines. Especially tell your doctor or if you or your child take antidepressant medicines, including MAOIs, blood pressure medicine, seizure medicine, blood thinner medicine, cold or allergy medicine containing decongestants, and stomach acid medicines. Know the medicines that your child and you take. Keep a list of your medicines with you to show your doctor. Do not start taking new medicine while taking mixed salts of a single entity amphetamine product without talking to your doctor first. How should it be taken? Take mixed salts of a single entity amphetamine product exactly as prescribed. Your doctor may adjust the dose until it is right for you or your child. Mixed salts of a single entity amphetamine product are usually taken 2 to 3 times a day. The first dose is usually taken when you wake in the morning. 1 or 2 more doses be taken during the day, 4 to 6 hours apart. Mixed salts of a single entity amphetamine product can be taken with or without food. From time to time, your doctor may stop mixed salts of a single amphetamine product treatment to check for your ADHD symptoms. Your doctor may do regular checks of the blood, heart, and blood pressure while taking mixed salts of a single entity amphetamine product. Children should have their height and weight checked often while on these medications. If your child or you take too much mixed salts of a single entity amphetamine product or overdoses, call your doctor or poison control center right away or get emergency contact. What are the possible side effects? What do you need to know? Slowing of growth, height and weight in children. Seizures, mainly in patients with history of seizures. Eyesight changes or blurred vision. Serotonin syndrome, a potentially life-threatening problem called serotonin syndrome can happen when medicines such as mixed salts of a single entity amphetamine product are taken with certain other medicines. Other symptoms from that include agitation, hallucination, coma or other changes in mental status, problems controlling your movements or muscle twitching, fast heartbeat, high or low blood pressure, sweating or fever, nausea or vomiting, diarrhea, stiffness or tightness, stomach ache, decreased appetite, and nervousness. Talk to your doctor if you have side effects that are bothersome or do not go away. This is not a complete list of all possible side effects. Ask your doctor or pharmacist for more information. However, some people see the world like this totally, with flowers and beauty and love and yellow for friendship and sunshine and light. And I pray that someday we can all see the world like that, in joy and happiness and love.